critical part of performing a hip spine analysis in VIEW is having good quality images to use. Ideally, this means that the images were taken following our imaging protocol. But I know that's not always the case. And sometimes, even with the best trained radiology staff, the reality is that landmarks won't be optimal due to factors outside of your control. Tip 1. Look for asymmetries. When defining the anterior pelvic plane tilt of a patient, it is critical to bisect the anterior superior iliac spines. Although they will sometimes be perfectly symmetrical, it is much more likely that there will be some axial rotation. You should look for asymmetries. If you can see two distinct acetabula, there is axial rotation in your image, and you should also be looking for two distinct ASIS points. The amount of rotation in this patient is very notable. As you can see, the two femurs are not aligned at all. The first ASIS is well defined, but the other is more difficult to see. You can try adjusting the brightness and contrast to visualize this better, but sometimes even that won't work. Which brings me to my second tip. Follow the iliac crest. When the ASIS can be hidden and difficult to find, it can be helpful to follow the iliac crest down along the shape of the pelvis to approximate the landmark. So we see our iliac crest coming down along here. And based on this, we can place our anterior pelvic plane tool here. And there we go. We get about 14 degrees of anterior tilt for this patient. This example has much less axial rotation than our first. We can see that the femurs are relatively aligned and parallel, and that the acetabula are very close, but not quite overlapping. Similar to our first image, one iliac crest is easier to see than the other, but we can still tell that there are two visible. As a result, we need to bisect the two visible ASIS points, which leads us to place the landmarks here. Defining the pubis point and then bisecting the two ASIS, resulting in 8 degrees of anterior tilt for this patient. Here's another example of where one ASIS is very easy to visualize and the other isn't. But based on the curvature of the iliac crest, you can follow it downwards and see the 2 points. What about the third tip? Of course, I was just saving the most challenging case for last. Here's an example of where bowel gas is really obstructing the landmarks we need. Brightness and contrast can't help us when dealing with this type of challenging lateral image. But remember, you also have the AP image, the perpendicular standing view to get insight from too. Consider this patient's AP image. The inlet view of the pelvis gives us a clue that the patient likely has a significant degree of anterior tilt. This is helpful, since a first glance at the lateral image might suggest a posterior tilt. After looking at both images together, it becomes apparent that not only is a second ASIS visible, but what could have been mistaken as the pubis is actually part of the femur, while the true pubis point is further posterior. Now that we have the correct pubis point and we can find our ASIS, we see that this patient has around 16 degrees of anterior pelvic plane tilt, which seems to meet our expectations from the AP view. Keep in mind that this is a particularly challenging and unusual case, but it certainly highlights the value of looking at multiple views to get all of the information you have to gain perspective. So to recap, 1. Look for asymmetries. You should always be looking for two ASIS points to bisect when defining pelvic tilt, but especially if you notice two acetabula or femurs that are not aligned. 2. Follow the iliac crest. It can be really helpful to find the iliac crest and follow it downwards to find the ASIS. 3. Consider multiple views. Don't only look at images independently. Use the knowledge that, generally speaking, the same pose is being displayed in the perpendicular plane to gain more insight, like considering inlet and outlet views of the pelvis on an AP image. Hopefully these examples have helped boost your confidence in landmarking on lateral images. Good luck and enjoy using VIEW for all of your hip spine assessments.